Hi, I'm Mark Brodsky. I'm a physician who takes care of performing artists, and this is Bryce. Nice to meet you, Bryce. Can you tell me a little bit about the pain in your forearms?
Well, it started, I just got this shooting pain. My arm swelled up, and I started noticing in the other arm. And when I play too much, I was getting pain from back here to here, mostly on the bottom, sometimes on the top. I've had some physical therapy I've been going through and some other things, but it hasn't quite healed up, I guess.
How does this injury affect your playing or the sound of your music?
Well, actually, because if I played, it would make it worse. I had to stop playing for a while and limit any regular playing. I'm just starting to try and play again.
When did your symptoms first come about, and what do you think was the cause? Was there any kind of trigger for them?
Well, I guess it was just one day it just started shooting, but I think it was caused from maybe tight muscles. Been doing a lot of stretching, and maybe some bad technique in piano, maybe raising my arm and saxophone kind of pushing it out. Maybe some bad technique, tight muscles, and overuse, I think, maybe.
Okay, overuse is actually a common problem for all musicians with upper extremity and neck problems. Do you notice any tension in your neck or your shoulders?
Yeah, sometimes I've noticed some back pain. Gotten some different straps and tried to stretch and have good posture.
Okay, great, because neck pain is actually an under-recognized focus of a lot of pain in musicians. That, we don't really recognize that we have neck pain until we kind of push around there a little bit or try to turn our head to the right and the left. How's the range of motion in your arms? I want you to lift your arms up in the air.
It's pretty.
Okay, any tension there in the neck and shoulder or limited range of motion?
It seems all right.
Okay, when you sit up straight and turn your neck to the right and the left, how far is it? Let me see the range of motion there. Can you turn any further? And what about to the right? Okay, any tension you're feeling in the neck when you do that, or pain when you turn to the left or the right?
Not particular.
Okay, so let's kind of go back to the story. Many times when we have muscle knot pain, it can be kind of from an overuse, a micro trauma or repetitive injury kind of situation like you describe. Also many times emotions and can become involved, like stress. So if you were to come to the doctor, we would ask you what kind of, we'd try to find out about you, your life, your childhood, how you manage stress. There's anger as an emotion that can, make these points tense up as well, so we kind of want to address that. And then once we kind of understood the story, we'd kind of get onto a physical exam. We test your nerves, so it's very important. There's some places along the neck to the hands that the nerve can get trapped, so that we would test for that. And there's some coordination problems that are actually caused by the brain that we'd want to check out for. So these are just some reasons why we'd want you to, see a doctor and get a diagnosis, and then create a self-care plan and also any kind of treatments that might be involved with that. But we're here to talk now is about things you can do for yourself and self-care. So some of the things you can do, can you play your instrument for us? That's kind of part of the physical exam, and what we like to see is, is there any kind of extra tension?
So you want me to just play just anything, I guess?
Play like a scale or just anything you want to play, actually. Thank you very much. Why don't you have a seat? Can you share with me some of the advice maybe that your music teachers or physical therapists have told you to reduce some tension in the neck and the arms and the forearm areas?
I guess I started going to Alexander's teacher, and they talked about as far as just noticing when you have more stress, like in an area that you don't need stress, like your neck if you're standing up, or like if you're playing, make sure your shoulder's not up, and just trying to go really slow and pay attention to those areas, and then just think about not using them. I guess that's been the most helpful. And then the physical therapy is really about doing stretches all the time, and I would do some kind of exercise, and they kind of push out. They say there's some scar tissue and stuff.
Okay, what kind of stretches are you doing? Can you describe those?
Well, the ones I just elbow straight, like that, 10 seconds, 10 reps, and then there's another one like this, 10 seconds, and then that's with both arms, and then for this one it's you kind of pull this way if your arm's straight, and you go like this to stretch out.
Okay, great. Another thing we look at is ligament laxity, or how flexible the fingers are, which sometimes, especially when you're holding an instrument under pressure, can cause some increased tension on the forearms. So I want you to do a few things. Can you take your thumb and try to kind of touch your wrist? Are you able to do that?
Oh, no.
Okay. That's all right. That means that it's not very lax. That's okay, actually. And then the forefinger to the, how far does that go back? Okay. So that's just one of the things we look for that can set people up for injury, but you don't have any kind of ligament laxity. Another thing we look for is trigger points or pressure point, muscle knots. So is it okay if I grab your arm here? And unfortunately, I wasn't able to see your forearms when you were playing, but it would have been interesting to see if there was kind of extra tension, in the muscles of the forearm right here. Can you roll up your sleeves for me? Okay, so I'm going to kind of push on a few points. And can you show me where you feel the tension in your arm while you're playing?
I used to have most of the pain kind of down here, and then right in like this kind of region.
Okay, so kind of the muscle right here, because there's a very kind of powerful pressure point here. You feel that right there?
Yeah.
So one of the things that we would teach you, along with the stretches and good posture, use this hand and hold your side, and then place your thumb starting where the watch would be, and take a breath. And that's a nice breath. You're using your diaphragm. That's the way we relax. Some people kind of use their shoulders to breathe, but that was a nice breath. And then you're aiming for the crease right here, the front of the bone right there. So you want to kind of go halfway and kind of press again with a breath. And make sure this arm's down and this arm's down and everything's close. And take a breath. And then the last point is right here. And that's perfect. You want just enough force for the tip of the thumbnail to turn white, which is good. Not too hard, because you want everything relaxing, not under tension.
Okay.
Is it okay if I have you stand up?
Yeah.
Going to just kind of press on some points in your neck here and let me know if anything's tender. So I'm going to kind of walk right here.
I feel that.
Okay. And not pushing that hard, but that's a tense point. And how about right here?
Oh, not as bad as the other one. Oh, yeah, I can feel it.
Right there. So there is actually kind of some tension in your neck and shoulder, and I'm going to push a point on your neck right here as well. So can you let your chin drop and relax? And I'm going to push a point kind of in the back of the neck here. Is that tender right there?
A little bit.
And what about on this side?
Yeah.
Yeah. So the ways to kind of relax these points are to interlock your fingers, kind of put them behind your neck like this. And the spot is right here, right kind of behind the neck.
That's like this.
Yep.
You just press.
Yep.
Take a breath.
Yep. And kind of let your elbows fall. Take a few breaths. That looks like a good spot. Why don't you have a seat? So along with the stretches and the posture and things that you learn from your teacher, those are some very powerful points you can push to get relief from your pain. What kind of exercise? Are you a regular exerciser?
Yeah, I was playing a good amount of basketball and running, and I stopped doing some of the basketball stuff because it was in this same motion, so I wanted to but I started a little bit playing some basketball again.
Okay, because it's really important to stay in good shape, you know, for the muscles, because if the body's deconditioned, the muscles don't act like we want them to. And can you tell me about your diet? How's your food you eat? What are they like?
I'm vegetarian. I like organic food, healthier food, smaller portions, but
Excellent. And caffeine, is caffeine something you drink regularly?
Not regularly. I do like some coffee in the morning, but I don't drink it every day because I don't want to. Then you get dependent on it. But
probably a cup of coffee a day is okay, but we always ask about caffeine intake because the caffeine can make the muscles tight. Some people drink a lot of coffee or a lot of Coca-Cola beverages or soda beverages. And what about your sleep? How's your sleep?
It was all right. That was one thing. I wasn't sleeping a lot for a while. When I had to start taking it real easy, I started making sure I got 8 hours so that my muscles were repaired. But there was points where I was sleeping not very, like 4 hours.
Right. So all these kind of lifestyle factors too are really important, so the body can kind of return to its resilient self and kind of manage some of these symptoms. In terms of stress, do you ever notice a correlation or that stress affects the symptoms?
I usually have a lot of things going on. I could try to do a lot of different things, but I haven't noticed the stress correlating with the tightness. I guess I haven't found a way to exactly correlate what happens when it gets tight. But.
Okay, great. One of the best ways to do stress relief is to kind of just do your points and then breathe. You know, a slow breath is a great way to relax.
So what do the pressure points actually do when you press the?
The pressure points do a couple things. There's been kind of studies that show that these acupuncture points, when you stick needles in them, actually turn down a part of the brain that's responsible for stress and pain, called the limbic system. And probably if we push on those points, that there's some sort of overlap with that. Also, when we push on muscle knots that are tense, the body's self-healing kind of releases these. And in the office, we'll stick needles in them sometimes, or acupuncture needles. More likely in the bigger muscles in the neck, but in the forearm, if you push those muscles, it basically kind of tells those muscles to release their tension. And I encourage you to do that every day.
Okay.
Yeah. How do you feel like your symptoms are coming along in terms of playing? Is your playing easier, or do you still have to stop while you're playing?
Well, I started playing some again, and I haven't had any major problems. I guess I'm still not sure, I know the muscles are weaker than they were, so I'm not sure sometimes if my muscles are tightening up, or if they're just kind of sore from playing. So I guess I'm not playing nearly as much as I was, but I'm still having some trouble recognizing if what I'm doing is good. I'm not sure if, when to stop or when it's too late.
What do your teachers tell you in terms of how much to play and how much to practice? Do they have any guidelines for you in kind of rehabilitation?
Well, a lot of my teachers really haven't dealt with this. It's more of a piano kind of thing, but it's also just something that is more, I guess, vague amongst musicians I've talked about. It's kind of like, it's happened to a good amount of people, but there's not, I guess, wider recognition of like how to treat it or how to deal with that kind of thing. And I have some teachers that really understand, that just say, it's take your time. Then there are others that really don't understand. Why don't you can take the pain or anything, but it's not, it's more about getting better, because if you just keep, like, stressing a muscle that's like damaged, then you're just going to permanently hurt the muscle.
Exactly, and it is important to listen to our bodies. Okay. So I would recommend that you can continue your good lifestyle habits, and the stretching sounds great, and to continually work with your teachers to look for postural and technique changes, and to do the acupressure once a day.
Okay.
With a breath.
Okay.
You have any questions?
I guess. Is there any other resources if I continue to have trouble?
Yeah, absolutely. There's an organization called Performing Arts Medicine Association that's made up of musicians, teachers, and physicians, and together try to improve quality of life and wellness for musicians and all performing artists, actually. And they have a website you can access. There's a list of doctors in the different areas that are sensitive to kind of the unique needs of musicians.
Wow, that's great.
Okay, nice to meet you. Thank you.